Less than 2.5 months until Florida's new law cracking down on opioids goes into effect. That means doctors will be limited to prescribing 3-day supplies of opioids with a few exceptions. The law also adds new training for doctors. Governor Scott says the new rules will help Florida's opioid crisis, which kills 6,000 people a year. That's about 16 people a day.
A lot of you say these limits will punish patients and won't put a dent in the drug problem. But Nightside reporter Josh Sidorowicz spent some time learning how doctors are trying new methods to manage patients' post-operative pain while reducing the use of opioids.
Most studies look at approximately 50% of people addicted to narcotics start in a post-operative time frame. If we can reduce the amount of narcotics and opioids they're using, I think we can at least start cutting that back.
This is Dr. Stephen Greenberg, OBGYN at Florida Hospital Tampa. He says for procedures like, for example, a hysterectomy, he's avoiding opioids and starting his patients on pain meds like gabapentin, a drug for nerve pain, Celebrex, or something similar to Aleve, and even Tylenol.
By itself may not be doing that much, but in combination, those three really reduce the amount of narcotics that people need to take.
During some surgeries, he's also begun using a nerve block similar to an epidural, which he says can last for a day or two or even longer after the operation.
This is one of the medications.
Pain management pharmacist Shannon Robb showed us some of the alternatives.
So depending on whether or not our patients are able to take oral medications, we may choose to use the IV form of the anti-inflammatory.
She says people are asking for meds other than opioids like they haven't before.
What we've really seen in the last several years is that our patients are actually concerned about taking opioid medication because they've seen the news stories, they have witnessed perhaps other individuals in their lives get addicted to these medications.
But unfortunately, you can't deny the fact that this is not something that would work for every patient, Katie. I mean, some simply cannot take even a medication like Tylenol, and others, they fear that whatever the alternative is, it wouldn't be nearly enough for the pain that they're dealing with.
Absolutely. That's exactly what we heard from people in just about every situation tonight. And so many of you on Facebook Live wanted to get across one thing. Pain medication is not a one-size-fits-all situation, not at all. Candy, you're worried that you'll just have to suffer after surgery. Tylenol can hurt your liver and ibuprofen your kidney long term. When you have one kidney like myself and need a new knee, ... Bobby says, I had knee replacement and needed Norco and Tramadol for 5 weeks. What will that be substituted with? I can't imagine. And Karen, you pointed out that NSAIDs like ibuprofen have caused problems for you and are a non-option for a lot of people, and that's true. You say they hurt your stomach, plus some people dealing with health problems and taking blood thinners on a forever basis, you cannot take NSAIDs. And she's right. All of these alternatives to the opioids come with risks, from strokes to ulcers, even death. And that's why patients say they want to say in what meds they take.
Yeah, and all things Dr. Greenberg, he acknowledges, but he says too, until we can find something that is effective or almost as effective as some of the opioids were, that this for now he feels is at least a start. Limited, but a start.
All right, Josh, thank you.